Daytime television talk shows have never been known for giving the most reliable information to the public. A show called The Doctors is no exception. I'm going to go over a segment of the show that aired on the 12th of January 2011, last Wednesday if you're watching this video just after it's been uploaded. The segment is about the proposed circumcision ban in San Francisco, California. This bill would ban non-consensual genital cutting of minors when there is no immediate medical necessity. This bill is intended to protect minors and does not ban medically necessary or adult consensual surgeries. The clip begins with Doctor Drew Ordon making a horrible case for his position. Dr. Drew, you will henceforth be known as Doctor Fallacy. Let's begin.
Oh, wow, this is a whole can of worms,
only
man.
in San Francisco.
Only
in San Francisco.
only
in San Francisco.
Non sequitur, irrelevant of the reasons for the proposed ban. Ad hominem, attacking the city instead of the argument. Red herring, diverting the argument to the city instead of the ban.
Only in San Francisco. What next? What next?
Slippery slope, logical fallacy. Non sequitur, irrelevant of the reasons for the proposed ban.
What next? Is it going to be illegal to have a tonsillectomy or illegal to have your wisdom teeth removed?
Straw man argument. Nobody has said they'd like to ban tonsillectomies or the removal of wisdom teeth. Wisdom teeth don't contain over 20,000 sexually receptive nerve endings. Wisdom teeth are not removed until after the age of consent. Tonsils don't contain over 20,000 sexually receptive nerve endings. Tonsillectomies are no longer performed on infants unless medically necessary. And finally, a red herring, diverting from circumcision to non-related procedures.
Wow. Well, people feel very strongly about it, but I think that the thing is that it's still a choice. It's a personal choice. Still a choice. It's a personal choice. Still a choice. It's a personal choice.
Is circumcision a personal choice? If you're of the age of consent, then yes. Getting circumcised could be your own personal choice. But is it a personal choice to force a genital amputation on a non-consenting individual without immediate medical indication?
What we're really talking about is forcing an irreversible surgical procedure onto a child at the parents' wishes rather than at the child's wishes.
We have pros and cons on both sides, and there's nothing to show that there's anything, horrendous on any side. And there's nothing to show that there's anything, horrendous on any side.
What about the fact that male circumcision removes the most sensitive part of the penis? The foreskin is not only the most sensitive part, but more sensitive than even the most sensitive part of the circumcised penis. What about the fact that male circumcision removes virtually all the fine touch nerve receptors of the penis? Meissner's corpuscles are the nerve endings that sense fine touch. Without them, you can only feel the remaining sensations: pressure, pain, vibration, and temperature.
Horrendous on any side to make a ban on it. I think a lot of people get up and roar because they think we do it without anesthesia.
Right, that's been going on thousands of years. That's been going on thousands of years. That's been going on thousands of years.
An appeal to tradition or an argument from antiquity. Just because we've done something for a long time doesn't mean it's a good idea.
I think this article from this piece shows that there was in this article, someone was quoted saying most circumcisions are done without anesthesia. That's not true at all. I have never seen a circumcision done without anesthesia. That's not true at all.
That's simply incorrect. Anesthesia is not always used.
I'm sure it hurt, but I don't remember.
Would it be okay to rape someone if you used a roofie? I'm sure it would hurt, but you wouldn't remember it. The pain may be horrible, but it's nowhere near as horrible as the human rights violation that takes place through non-consensual genital amputation without medical necessity.
Well, you couldn't walk for a year.
I can't find the compulsory mutilation of the genitals of children a subject for humor in that way, or flippancy in that way. Maimonides says very plainly that it's designed to repress sexual pleasure, to deprive a male child as far as possible of the opportunity of that. The full excision, not just the snip or the full mandatory covenant is fantastically painful, leads to trauma, leads to the dulling of the sexual relationship, and can be in itself life-threatening at that moment. We have the records, I can show them to you, of hundreds and hundreds and hundreds in the United States, boy babies who've died or had life-threatening infections as a result of this disgusting practice. That a person as humane as yourself can sit here and think of that as a fit subject for humor shows what I mean. Genital mutilation is no joke.
Right? Of course it hurts. Right? Of course it hurts.
Good point. Good point.
Laughter helps ease our discomfort in these situations. But should our discomfort on this issue be eased?
What if a Muslim was to say to you just now, my little girl cried more at her first haircut than when I cut off her clitoris? What would you think of me if I was to say such a disgusting thing?
Well,
genital mutilation is no joke.
I mean, I think what's probably behind this, I know a lot of people feel, and I actually feel this way, I think it's not the best decision. I wish the person getting circumcised could make the decision for themselves.
Well, except for that it's
I know it's easier to do as your
when
baby,
you're
but
not going to remember.
Right,
because
but
I
I
can't
still
tell you
think
how many men go, well, you do circumcisions, can you do my circumcision?
right, and they're driving with their driving.
Yeah, they're
right.
like,
No,
oh.
but I still think it's a procedure. It's like if a parent decided, hey, I'm going to pierce your ears and pierce your nose and while you're a baby so you don't have to do it,
Well,
because I think it's going to be in vogue later on. I think it's best if the guy wants to be circumcised, let him decide when he's old enough to get decided.
But to call circumcision cosmetic, just cosmetic, that's not right.
In America, the most common reason given for infant circumcision is so the boy will look like his father.
Most of the people in this country do it because it's cosmetic.
But let's play devil's
There's some
advocate.
medical
There's
reasons to
health
do it.
reasons to do
There's
it.
also medical reasons not to do it.
Do you think you're basically saying that a parent should not be allowed to decide? Because again,
it's a can of worms.
You're making decisions for your child about their medical future until they're the age of 18 or they're an emancipated minor. Either way, as a parent, you would always hope that you make the best decision when it comes to your child. But that's what you do. You do that from when they're born until, like I said, they're of age to make their own choices. And so, how is it different here? How is it different here?
Decisions. So what about the child's right to decide? Does the parent have the right to remove any other part of the child's body without immediate medical necessity? There are no other non-medically necessary child amputative surgeries allowed on the grounds of the parent's right to decide. Why is this procedure the only exception?
Well, for me, I don't think that the foreskin is a birth defect. I think if you want to keep it, well, that's why. But a lot of people, I think they feel that way. They feel. No, I've had a lot of parents say, I need to get that foreskin off because it looks funny.
Well, there's also that, but then there also is the health aspects behind it. We know they can decrease penile cancer.
Yes, if you cut off a part of the body, it cannot become cancerous. Penile cancer is less common than male breast cancer.
Yeah, but listen, more babies die getting circumcised than men die from penile cancer.
Well, but also HIV and AIDS. We know that actually there's a lot of places in Africa that are instituting it because it actually decreases the risk of HIV and AIDS.
I agree.
If circumcision was a good measure in reducing the rate of HIV/AIDS, you'd suspect to find a correlative trend when comparing areas of the world that circumcise more to areas with similar cultures that circumcise less. Here are the HIV/AIDS rates for the United States and several European countries. You'll immediately notice that the HIV rate in the US is anywhere from 3 to 11 times greater than in Europe. The current newborn circumcision rate in the United States is, more or less, around 50%, with the adult rate somewhere over 70%. The circumcision rate in Europe is well under 10%. Now you tell me, does it look like America's circumcision experiment is preventing more HIV than Europe? Here are the HIV/AIDS rates for several South African countries, where they are circumcising men under the claim that it will help prevent HIV. As you can see, the HIV/AIDS rates are higher among circumcised men in most of these countries. If you think circumcision will help reduce HIV infection rates, think again. It may, in fact, have the opposite effect.
agree with that, but it's not 100%. It's not. If you're going to use that logic, you might as well just sew a condom on the penis when they get born.
Well, let me ask you this though. You name one baby to me, and I'm not pro or con when it comes to circumcision.
Yeah.
But I know a lot of guys who've been circumcised when they were babies, and not one of them has ever said, "Wow, that was rough."
Hell, if you'd like to see some men who aren't very happy that they were circumcised against their will, scroll down and read the comments section of this video.
In other words, you know, there are a lot of guys who are circumcised who are like, thank God that I was just taken care of back then because I'm glad it was done. And it's not a procedure that I think, you know, a 14-year-old or an 18-year-old is going to walk in and be like, all right, I just turned 18, let's do it.
Exactly. So why would we allow someone to force this on them non-consensually?
Yeah, right.
That's a good point. They want to put a ban on it. It's not a ban on circumcision. You can't even compare it to female circumcision or female genital mutilation or female cutting.
Female circumcision type 4 pricking is illegal in the United States of America. This consists of pricking the clitoris with a needle to draw a single drop of blood. It does not remove any tissue or nerve endings. Male circumcision, which is legal, removes what will become 10 to 20 square inches of highly erogenous tissue that contains over 20,000 specialized nerve endings, virtually all of the fine-touch nerve receptors of the penis, the most sensitive part, and removes the entire gliding mechanism.
So you can't even, compare apples and oranges.
I'm curious, though. I'm just curious, though. I know we consider female circumcision as mutilation, but I mean, does it change the function? Does it change?
Yes, it actually changes
birth?
The function. It actually changes
I'm just curious.
The function.
Does it change birth?
The function. It actually changes
I'm just curious.
Male circumcision changes the function by removing an entire sensation, the entire protective covering, and the entire gliding mechanism.
Actually curious what they do. Do they remove the clitoris?
Yes, they actually remove the clitoris, but they also close up the vagina as well, which can cause severe dysmenorrhea.
So that has to do with childbearing later on.
It can cause death because people aren't...
Remove the clitoris?
Yes, they actually remove the clitoris, but they also close up the vagina.
Not all types of female circumcision remove the clitoris. Infibulation, or closing of the vaginal opening, makes up less than 10% of female circumcisions. Removal of the clitoral hood, or foreskin, is one of the most common forms of female circumcision. Both male and female circumcision violates one's human right to bodily integrity.
You're removing erectile tissue, and that's different. I mean, a foreskin is
Well, you're removing a lot of nervous tissue, too, with the foreskin, too.
Yes, but the studies have actually shown that most men who undergo circumcision do not have any sort of nerve damage at all. Most men who undergo circumcision do not have any sort of nerve damage at all. Most men who undergo circumcision do not have any sort of nerve damage at all.
How do you define damage? Is the removal of a great deal of nerve endings a kind of nerve damage? Let me know in a video reply or in the comment section.
Did you read in the news last week that the city of San Francisco is considering banning circumcision for
Yeah, and again, but that's a personal choice. And I talk to my patients as an obstetrician. I talk to my patients a lot about this. And really, there's a lot of health benefits and some risk benefits, but it's really a social procedure. So you really have to decide, do you want your son to look like you? Do you, is it a cultural thing? Is it a social thing? It's absolutely, and there's some health benefits, decreasing STDs and cancers, all that good stuff.
But couldn't you achieve the same effect by washing your pee-pee on a regular basis?
You absolutely could. And
So we're talking, you can have this chopped off or you can wash it. Your call.
Exactly.
It's a tough choice there, Doctor.